Okay, hi, good morning, dear students. And today we are going to discuss about the Australian intern oral examination. Normally, that examination is considered as the last step for getting towards your licensing exam process in Australia. Oral examination is the one of the integral part, and today with us the Khushbu Panchal. She has recently completed her intern oral examination. So we are going to get the better understanding about what are the key important facts, points, and the preparation strategy and roadmap. What need to be followed in order to pass the examination without any difficulties. Okay, so let's invite the Khushbu on board, and she is going to start giving us the information. Hi Khushbu, thank you very much for joining the today's session, and we are so fortunate you are going to share your experience with us. So many students, those who are inspiring and preparing at this point of time for the OPRA examination, are going to get the values from your insights and experience. Okay, so before we start discussing further, can you tell something about yourself, like how was your journey as a pharmacist from your graduation to Australia? Okay.
First of all, thank you very much for inviting and giving me opportunity to speak with others how my journey gone. So I cleared my B.Pharm in 2011 in India, and then I came to Australia for my Master of Biotechnology that I have cleared in 2014. And then after I worked as a research assistant, but it didn't satisfy me. So I thought I should go back in my pharmacy career. So I thought to start all the process, skill assessment and everything. But the gap was affecting me after my completion and start the whole journeys. But then after I found the Pharma Vision, that helped me a lot. Sir has explained all the videos very well with his 100% energy. So yeah, I'm very glad that I found Pharma Vision and I cleared my CAPS in 2024 and now I have cleared my oral exam in 2026. So I'm very fortunate.
Okay, so congratulations for your OPRA examination. And before we start discussing further, can you give overview about the oral examination? What the OPRA oral, was the intern oral examination in Australia? What is the structure of the examination?
So oral examination is 35 minutes examination. So it consists of three parts. First part is 10 minutes that over-the-counter medications they will ask you about. So patient comes and you have to give a proper treatment and non-pharmacological treatments as well. And Part B is a legislation and ethical question. That's also the 10 minutes. And Part C is the 20 minutes, and that's the biggest portion of the exam. And that comes with the case-based scenario. Patient has a multiple condition and it comes with the prescription. And you have to find the problem in a prescription and what the patient is asking, and you have to give a suggestion. In that scenario, you have to talk to the doctor as well as the patient. So your communication skill and how you deliver your message to the patient and doctor, that's very most important thing.
Okay, perfect. So you said 10 minutes, 5 minutes, and 20 minutes.
That's right, yeah.
Okay. So in over the counter, normally they have a number of questions or number of case studies, or it's only 10 minutes.
It's 10 minutes, just one question. Patient comes with the asking you for treatment. For example, if patient is coming and asking something for cough. But in that case, you have to ask patient some questions to get what kind of cough he is having. He was sick previously, or how he has how he got a cough, or he's taking any other medication, or is he having any other condition that causing the cough. If he's taking AC inhibitor and he's asking you something for cough, then you might got a strike that AC inhibitor causes a dry cough.
Okay.
And if the patient, yeah.
So it's the only one scenario or one situation, and you have to entire one situation you have to handle, like over the counter cough or hemorrhoids or emergency contraceptive or whatever. But the
Yes.
one
Yes.
situation, one scenario, you have to diagnose, you have to make a decisions, and you have to counsel the patients. Everything you have to
Yes, that's
complete in 10 minutes. This is the only one scenario.
it.
Okay,
Even
perfect.
sometimes, even sometimes examiners ask you alternative as well. So you have to prepare yourself to give alternative medications.
Okay, okay, perfect, perfect. Now, in legislation, normally what kind of questions you can expect and how to handle those questions?
So these are mostly the legislation questions, like control drug script is valid for 8 months, 6 months in Australia. So if the patient comes with a 7 months old script, so at the straight away you should come in mind that this script is expired. So anyhow, you won't dispense that script, but you have to convince that patient what is holding you back to not dispense that script. So you explain the patient that your legislation won't allow you to dispense this script, but you recommend something because patient is in pain. So you recommend at the moment something that can help patient to for that pain, and you are also safe side for your not dispensing that control drug.
Okay.
So these kind of situations arise in part B.
Perfect, perfect, perfect. So, like basically, we have to learn reviewing the prescriptions and the part of prescriptions, like who are the legitimate prescribers or expired prescriptions,
Yes.
controlled
Yeah,
drugs.
you check if the patient is taking doing the polypharmacy, the same script, but he is using to the other pharmacy as well, and fraud scripts.
Okay, perfect,
Yeah.
perfect. So, you will get 5 minutes to handle this situation.
Yes, that's right. Yeah.
Perfect. And the third, part C, is the case based scenario. So, normally they are handing you the prescription and you have to start asking the questions, or they are giving you the like real life scenario type of situations. I mean,
So
the patient is like examiner is giving you the metformin 500 milligram one tablet daily. That's the prescription. Okay, you have to
yeah.
read the prescription and then you have to start asking the questions. That is the situation, or they are giving the Mr. X is suffering from this and this, and you have to solve those questions.
So they will give. There are two examiners in this part. Say so. One is patient and one is doctor, and we are pharmacist as a student. So they will give you prescription, and the patient also tells you that he went to see doctor and he is asking for glycoside. So and there is also give you the paper as a prescription, and that it has a multiple medication.
Okay.
So, and in this part C is the question, history taking is very important.
Okay.
You have to ask as many as questions, and then after you will get information, because in this scenario the hidden information patient will tell you, you won't get straight away from the prescription that this interaction glycoside interacting with any other things. But if you have to ask patients that why he has to see doctor, and what makes him to see doctor, is he regular doctor or is he a new doctor he's seeing today, or any other medication or any other patches he's using, any inhaler he's using that's not in prescription, and is he got any recent blood test, any thyroid function result he knows. So as many as questions they has to ask. Any over the counter medication patient is taking that interacting with his current medication and that caused this situation. So you have to ask all the questions to get the information from patient, and then you have to use the e-memes. That's the kind of the website that provide, that's very helpful to find out the interactions in pharmacy.
Okay.
So every pharmacy use those websites and AMH book.
Okay, so
So yeah.
we are going to come to that part, like what are the resources
Yeah.
available in the exam. But
Yeah.
here in the section C, how many questions or how many prescriptions they are going to give you, and like is there any time frame within the 5 minutes or 10 minutes you have to solve the one prescription question, and they give you
So
the another one?
yeah. Part C, they will just give you one prescription and you have 20 minutes. So
Okay.
you have to divide that 20 minutes, like 5 minutes in history taking,
Mm-hmm.
5 minutes to find the problem, what you finding the problem in prescription and what the patient tells you.
Mm-hmm.
5 minutes taking in talk, because in these situations you also have to talk to doctor as well. You have to call the doctor and discuss the problem with the doctor, and what doctor suggests you have to pass that information to the patient. So
Okay.
5 minutes
So
talking to doctor and
normally,
5 minutes judgment.
so normally they are going to give you the little bit complex kind of situation. So you are going to perform pretty much all the skill sets in the exam hall. Like,
Yeah, part C is the complex situations. They will judge your all your skills in that clinical skill, as well your judgment decision, as well as your communication, how you dealing with doctor and how you passing that doctor's information to the patient. So all the skills is part C. They're gonna judge.
perfect, perfect. That's a really good. Okay, so now in exam hall, you have to sit only in the one exam room for 35 minutes, or you have to move from one to second to third. What the
35
exam
minutes,
setup?
just one room. Yeah, no, just one. From the waiting room, they will take you to the one room, and in that room, there will be a two examiners,
Okay.
and 35 minutes, you and two examiners on one room only.
Okay. So it's
Yeah.
not like a hard code kind of time like things. For example, if they give you the OTC and 10 minutes time, like if you are going to complete within the 6 7 minutes, they are going to move to the next question, and then they move to the third section, or they are going to wait till the 10 minutes to complete the entire
Yeah.
section.
Yeah, they will ask you more questions if you are finishing 7. If you finish in 6 to 7 minutes, they will ask you more questions.
Okay.
Like what the other treatments, or what if these, and then what you gonna suggest, or you wanna tell anything more. But they will wait for 10 minutes.
Okay, so that means this exam is not kind of they are asking you the questions and getting the answers. It's a more kind of subjective to evaluate your holistic approach, how you are going to practice as a pharmacist in real life, and how you are going to add value into the patient's care. So it's more kind of subjective and dynamic kind of situations, like they are
Yeah,
going to
that's
ask you the
right. Yeah.
question as per the situations, and
Yeah,
they are
yeah.
navigate you through, and they try to understand the what kind of skill sets you have, and are you really competent enough to practice as an individual pharmacist or not. Okay, that's perfect.
Yeah, that even in an internship, you got a chance to talk with the patients as well. So I would say take this opportunity as much as during your internship to communicate with patients. That helps you actually in exam.
Perfect, perfect. So what this exam is considered as an open book exam or is a closed book exam?
Or two parts are closed book. Part C is open book.
Okay.
So more about part C is open book. You can use resources, but part A and part B you won't be allowed to use any resources.
Okay, so in part C, what are the resources available in the exam hall?
Exam hall won't provide you any resources. You have to arrange by yourself.
Okay.
AMH book and APF book, I
Okay.
would suggest, and also the e-memes. to check the interactions.
So e-memes is in the computer is available in the exam hall, or you have to like how you can get access of the e-memes?
So yeah, we have to bring our own
Laptop.
devices, as
Okay.
well as we have to arrange our own internet as well.
Okay.
Exam hall won't provide you anything.
Okay. So, like normally, I have seen so many students, they are taking their own AMH with all the stickers and the highlighters and kind of
Yes.
stuff. So,
Yeah.
we can do that. Is like legally is allowed to use such kind of resources, or
Yes. So AMH, you can highlight the important points, and that's very helpful actually in an exam when you are really in stress. So highlighted things you can visual easily and find out that problem. And tagging is easy to go through the chapters. Like if it's a psychotic, you just tag the psychotic, and on the front page there will be an index of the each drug. So you directly go to that page. So that's the easiest way and less time consuming way to tag the book to find the drugs easily. Otherwise, it's more than 1,000 pages, so hard to find.
The one practical advice I would like to give to the students is what do you think? Actually, when we are come across the open book exam, that means the whatever question has been asked by the examiner, do really we have to look each and every points from the resources, or some of the critical points only we have to look at the resources, and we have to make sure. Like for example, if the doctor has asked the like examiner has asked the questions about the hypertension medications like ACE inhibitors, the patient haven't had this medication before, so that's the straightforward kind of things. Or for example, is a ramipril 10 milligram one tablet daily, that's the instruction. Okay, and patient haven't had this medication before, so it's a clear case of the counseling need to be covered in detail, and you know everything. So is it recommended again we have to look into the book, or no, if you know then you don't need to look at the exam in the book, or what I'm trying to say is, for example, if 4-year-old boy with the cough and the prednisolone oral drops has been given, in that situation we have to calculate the dose, and in that situation is mandatory we have to look the references and give the answers. You mean every questions we have to open the book, or it's not advisable? What is your
No,
opinion?
it's not advisable to look each and everything, because the common medications, you should remember the common counseling points as well. Like the ramipril, it will cause you the dry cough. It's do not take any potassium supplements with that. So these are the common medications. You have to remember that common points, because if you going to look each and every points, you're gonna run out of the time, because this is a time constrict exam. And even examiner also checking that how your knowledge is. It's good that you check the dose of the prednisolone 1 milligram per kg. So that we have to check what the maximum dose we can give 1 milligram per kg. And if you don't know the child weight, then the common weight given at the back of the AMH. So you can look at those things, but the counseling common medications, I would say you have to remember the common drugs and common points. Yeah.
Perfect. So, like specific disease condition, pregnancy, and child, in this situation, the dose verification is strongly recommended, but we should not have to rely upon the resources for every questions. Okay, that's really good advice,
Yeah.
because otherwise the
Yeah,
students are going to try to become more perfection, and the perfection paralysis will lead you towards the more
and they run out
confusion.
of the time. Yeah.
Yeah.
That's
Okay.
right. Yeah.
Perfect. So, what was your strategic preparation like methodology? Have you have prepared for this exam, oral examination?
So during my CAPS preparation, I did watch your all clinical videos 4 times. So I had a very good, I learned very good counseling and points in those clinical videos. So I didn't need to uh, do that much time for my oral exam. But during the internship, when I talk with the patients and when I talk with the doctors dealing with the hospitals, nurses, so those give me more confidence in communication with the patients, and that's really more important, especially when you're working in a regional area as a pharmacist. You will get a very vast variety of cases and you have to deal by yourself as a single pharmacist. So be confident, and you have to be confident on your knowledge 100%, no guessing at all.
Perfect.
Use your
Perfect.
resources, and and communication is the best part, and you have to be very efficient in that.
Perfect. I would like to add something on that. I have seen there are so many pharmacists, like pharmacy students, when they have started their internship at that time. Suddenly, if the medication prescription is coming in front of them, they are going to be blackout. They don't know anything. That's natural and normal at the like initial stage. But when you are doing your internship and continuously, if you are trying to get out from your position, go to the patients, and every time you try to counsel the patients, that will improve your confidence, and also you are going to start feeling more relaxed and remember everything. So
Yeah, that's right.
yeah, that's improve your communication. That also give you so many insights about what kind of questions should I have to ask and how to solve this problem. So
Yeah,
internship
yeah,
is the most important part, and that's why I think Australia is the only country in the world. They have a very specific structure. Like once you complete
yeah,
your 75% of your internship, then only you are allowed to sit for the oral examination. That means
yeah,
if you
that's
have
right.
done your internship in a proper format, you are easily you can crack the oral examination. That's the only matter of
Yeah, that's right.
communication.
Yeah,
Hmm.
yeah.
Perfect. So, uh, is it advisable to the students for making different kind of scenarios or situations, list out, make their notes for the preparation, or it's not required? Like whatever you have prepared for your
I
the first
think
exam.
in Pharmavision there's a OTC lectures as well. So
Hmm.
those are very helpful, and it has a self care card at the end. So
Hmm.
that self care card is very important for the counseling. You will get so many information from there, and that's the where because do you when patients comes and we say something that's common for us, but patient doesn't know those simple things like after using your puffer, steroid puffer, you have to wash your mouth. That we know, but we do not assume that he must know as well, and he's doing. Every time you give that puffer, just remind them gargle and throw out, spit out that water.
Perfect.
So those small things make a difference.
Perfect.
So yeah.
Good. So, normally, how the result is declared? They are saying the marks and kind of things, or is it you are competent, you are pass or fail? Like how they are declared the oral result?
So oral exam results they declare through email. They just say you are deemed successful, or but and when you are not successful, they will say you that in which area you are not successful.
Okay, out of
They will
three.
give you the reason like communication effectively was lacking. So
Okay.
they are not saying any percentage.
Hmm.
For the written exam, I'm expecting my result on 30th of July. So I'm not sure how they gonna say, but yeah,
So, like, how many questions you get in written examination? How many number of
75
questions?
questions,
75 questions. Okay, and
and that's 120 minutes.
75 questions, 120 minutes. And what type of questions you are getting in the intern written examination? And what's the question type difference between your OPRA or KBS exam and the intern written exam? What the question type difference?
So in a OPRA exam, there are very basic questions, and they from the bachelor's books, and bachelor's knowledge is more important. But this one is more of your judgment. They are also ask the counseling questions in a written exam. So, and the long questions, so you have to read and make your judgment. There might be two options correct, but you have to make your judgment which one is more you gonna say.
So, like a patient care and clinical and therapeutics are the major component in your second exam, like in intern oral written exam.
Written exam, yeah. And in written exam, if you're gonna see each and every, that's the open book exam, so you can take your AMH and APF. But if you're gonna look at each and every question in a book, you won't be able to find, and you're gonna run out of time. So, and in that 75 questions, the 10 questions not gonna be marked. So
Okay.
we not sure how many we and which question not gonna mark. So that's a little bit tricky as well. So you have to attempt all 75
Perfect.
and try to make finishing time. There will be a 6 to 10 questions of the calculations, and those calculations are those calculations and the percentage of the dilutions and those calculations.
So, is the PharmaVision video lectures and the preparation resources and materials can help in your intern written exam?
Yes, I watched even my written before my written exam. I watched that PharmaVision calculation videos 2 times, and I clinical videos definitely helped me. I watched 4 times, and I pretty much remember. When I close my eyes, I know what sir gonna say after this. So, but that helped me a lot in my counseling points.
Okay.
Yeah, that's helped me a lot in my counseling, the clinical videos, and those give me a very good, because I left my after 13 years of gap. I didn't thought I will make it, but the PharmaVision videos helped me a lot.
Okay, but it's a hard work and like your commitment. That's the only thing that
Commitment, consistency, and everything. Because in India, you will get a time to study, but when you come out, you have a family, you have a work, you have to balance everything.
it's very difficult, very
And
difficult. But it's
yeah,
now everything has been sorted out, so it's like good premium or rewards you will get. Uh, Perfect. Any advice would you like to give to those who are preparing for the Australian licensing process or licensing exams? What kind of 2 or 3 advice points that might be the students can get some advantage of those advice?
so yes, it is very advisable to do the licensing stream to be a pharmacist in Australia. That's the easiest way I think I can recommend, and also it's worth as well. The newly passed graduates, they can easily crack this process. And when you come to your internship, utilize those time very importantly, and learn as much as you want to from your supervised pharmacist. They're gonna help you in that time, but once you get registered, it's your responsibility for the patient safety and your license as well. So be confident in our internship and learn as much as you can. So, and yes, that's what my advice is. And PharmaVision videos helps a lot for that preparation. So take that advantage as much as you can. Keep consistent, be patient, and be confident.
Perfect. And the last question is mainly for the second, like intern oral and intern written exam. I think AMH is a very good resource for the preparation and practice to learn specific guidelines and how in Australia we are making the judgment and decisions in different situations. So, do you recommend it strongly? Like every student have to spend more time in AMH reading during their intern oral, intern written, and also during their internship time?
Yes, AMH and APF even APF is more useful in your part A when you are going for the OTC counseling. APF has all the situations and all the pharmacological advice for pregnancy safe and child safe medication distribution. So APF will be more useful in part A. Part B, you have to learn all your legislations A to Z. That's you will see from the PSA body and also the EPRA body. They have their own legislations and rules. And Part C, AMH, 100%, and EMIMS that you
Okay.
will get through your ITP portal. Yeah.
Mhm. Good. Thank you very much, Khushbu, for sharing your insights and the important information. So this information is really add value in those who are preparing for their intern oral and intern written examination. And okay, one more question is coming in my mind. What's the frequency
Mhm.
of the examination? Like how often these exams are conducting intern oral and intern written?
So I think 3 times a year they are offering in February, in June, and in October.
February, June, and
Both
October.
exams just 1 month apart. Yeah,
Okay.
2 weeks apart. So yeah, 3 times a year, but 2 weeks apart, intern and oral.
Okay. Mm-hmm. So intern and oral. So first you have to write the intern written and then you write the intern oral.
And that's not decided which one comes first
Okay.
because you can look for the specific date for return. But you have, because when you book oral exam, they will give you the whole month period from starting from 2nd of October to 31st of October. And in between, you will get any time. So you
Okay.
know your written exam, but you don't know when for your oral exam.
Perfect. Perfect. And like you have to register through your portal or how you can register your exam? You have to submit any number of hours you have completed letters from your pharmacy or
So no, we don't have to submit any specific number of hours, but in oral examination, they will ask you how many hours you have completed. So you have to, in the form of the oral exam registration. So you have to upload that form on EPRA portal. And for the written exam, the Australian Pharmacy Council portal, you have to book your written exam through the APC.
Okay.
And for the oral, EPRA portal.
Perfect. So written examination conducted by the APC and the oral examination by the APRA. Yeah. Okay.
EPRA, yeah.
Okay. So thank you very much, Khushbu, and best wishes for bright future. And you are going to make really good value in the Australian patient's life. Okay. Best wishes for bright future. Have a
Thank
great
you
time.
very much, sir, and
Okay.
thank you very much, everyone.
Okay. Bye bye. Take care.
Bye bye.